Dr. New here. Today, let's dive into the wonderful world of earwax. Yeah, you heard me right, earwax. Now, I know it's not exactly the most glamorous dinner conversation, but actually it is quite fascinating, at least for a nerd like me. And the topic of removing earwax is surrounded by myths, misunderstandings, and even a strange home remedy that could be quite dangerous. So in this video, we're going to cover why you have earwax in the first place, why some people get too much of it, how to safely clean out your ears at home, and when it's time to come see a professional like me. Let's take a quick tour of your ear anatomy. I was gonna bring out my big chalkboard, but honestly, my arms are kind of feeling tired. So here's a trusty mini version on my desk that I think will work. Oops, I got a little carried away and started doodling without you, but let me catch you up. So what we're looking at here is a quick sketch of the basic ear anatomy. On the outside, we have the ear, as we're familiar with it on the external surface of our head. If you had an earring in the lower lobe, it would go here, and I know you can put earrings all around here too, but that's another lecture for another day. If we look deep to the external ear, we have the canal, and this is where our wax would form, and deep to that, we have the eardrum. Now, surrounding the ear canal, we have a lot of soft tissues related to chewing and jaw function. And that's going to be important later in the lecture. Now, when I use my otoscope, that fancy flashlight we have, I'm peering down this tunnel. And if it's all clear, I get a great view of the tympanic membrane. Think of it as a window to your inner ear. But let's get back to the canal because that's where the wax forms. Okay, so first, let's give earwax some credit. It's actually healthy and natural. It serves as a protective barrier and controls moisture in your canal. Without that wax, the skin would become very dry and more prone to infection. Earwax is actually part of a built-in self-cleaning cycle. It traps dead skin cells, dust, microbes, and, brace yourself, even the occasional insect. Ugh, I know, that makes my skin crawl too. So as gross as it sounds, all of this wax is for a good purpose. But you might ask, how does all that earwax get out on its own? Well, every time we talk, chew, or belt out our favorite song in the shower, the muscles and soft tissues surrounding the ear canal help the wax move towards the exit. Bathing and showering, of course, help too. That's kind of nature's way of keeping things running smoothly and keeping those dinner conversations crystal clear. However, for some of you, this self-cleaning function seems to go awry. And this can happen for a number of reasons. Some of those factors are out of your control, like having ear canals with more twists and turns, or extra skin folds that make it tricky for the wax to escape. Some people just produce more wax, or it turns into a stubborn, dry lump. Both of these issues crop up more with age, but don't worry, earwax doesn't discriminate. We see young people in the clinic all the time for this issue. However, there are some factors that you can control. One common culprit that makes things worse: wearing earplugs or earbuds for hours on end. I know these tiny gadgets are convenient, but they really can trap wax or shove it deeper into the canal. If you're listening to music or you need ear protection for your job, try an over-the-ear style option. Your ears will thank you and you'll still look really cool. And now for the Q-tip warning. If you're poking around with cotton swabs in there, you might feel like you're cleaning, but most of the time you're just pushing wax deeper. Think of it as sweeping dirt under the rug. So my advice on this is keep the Q-tips to the external part of the ear if you need it. Don't put them in the inner canal, no matter how tempting it is. Underlying skin conditions like eczema or seborrheic dermatitis can lead to excess flaking and buildup of the skin, and that includes the ear canal. If you have a lot of itching in your ears, this could be the case. So how should people clean their ears on their own? Well, warm water is often enough. At least 2 or 3 times a week, intentionally flush the canal with warm water. This is easiest done in your shower or your bathtub. If you have some wax buildup, you should let the water set for a few minutes, then tilt your head to the side to let it drain out. You may need to repeat this a few times. Now, some of you are going to say to this, but getting water in my ears makes it worse. This seems counterintuitive, but let me explain what is happening here. If you've got a big amount of wax buildup, it can kind of form a dam or even a maze of tunnels that trap water behind it. Like a miniature water park in your ear, minus all the fun. But this only happens when there's already too much wax. If things are clear and there's just a thin layer, the water should drain right out. It's a dead end after all. Although the shower or bathtub works fine for most people, you can also use a device like a bulb or an irrigation bottle kit to create a bit more turbulence to loosen or remove stubborn wax. As long as you're not having pain, these devices are really safe to use. For some people with thick or hard earwax, they may need to use over-the-counter softening drops before they flush. Basically, just insert or squirt 5 to 10 drops in the canal, set on your side, let it rest for a few minutes. This will help soften and loosen things, allowing water to flush the wax out. You may need to do this for several days or multiple times per day if there's a large amount of hardened wax. And if you're prone to hard earwax, doing the softening drops at least weekly, even when your ears feel normal, may be helpful. Remember, it's much easier to remove small amounts than large impactions. Now for the please don't ever do this part of the lecture. Ear candles, just don't. They might sound like a cool spa trick, but they just don't work. The whole vacuum your ear clean idea is just a fantasy. If you actually created a vacuum in your ear canal, you'd be calling me with the burst eardrum, trust me. The brown gunk you see in the candle, well, that's just a parlor trick. It's just the burning candle wax, not your earwax, magically escaping. If you want proof, burn a candle on a plate. You'll see the same stuff, no ears involved. So save your money and your hearing. Also, there are many over-the-counter devices for earwax removal, including camera tools you can use with your smartphone. Attempting removal with visualization is better than going at it blindly, of course. However, if you don't have a steady hand and some knowledge, you can easily scrape the edge of the canal or even poke a hole in your eardrum. So I don't really suggest this for most people. If the home remedies I suggested don't work within a week, or you are experiencing pain, it's time to see a professional. Now, if you do have to come see a healthcare provider like me, we have a number of methods and tools in our clinic to help remove earwax. One is professional irrigation, and that just means we use a spray device with a special nozzle that flushes the ears safely and effectively. Sometimes we do need to manually extract that with a light source and magnification. I can use these tools kind of like scoopers or tweezers, or sometimes even a suction device to grab onto stubborn pieces. We try to remove all the earwax in one visit, but sometimes the plug is just too big or hard, or the skin is so irritated that it causes too much pain. In that case, we will prescribe some softening drops to be used at home for 3 to 5 days. Then we will have the patient return for a much easier extraction. Earwax isn't just annoying, it can cause some real health problems. The biggest one is hearing loss. This is especially critical in young kids learning to speak or seniors who already have hearing aids. Often, people don't realize how poor their hearing has become until we clear the canal for them. Another complication is otitis externa, also known as swimmer's ear. Wax can trap moisture in the canal, creating stagnant fluid that breaks down the skin and breeds bacteria. This is the exact same phenomenon when kids swim for many hours every day, but without the fun of the swimming pool or the lake. If you are experiencing severe pain or swelling, pus or foul discharge, or fever, this could be a sign of infection and you should see your doctor immediately. You will likely need antibiotics to clear this up, but we also need to clear out the wax so that the ear can dry out properly. I hope I've cleared up some things, pun intended. Remember, your ears are important, so treat them cautiously. If you're a member of our primary care program, earwax removal is a procedure we include at no additional charge. If you aren't a patient of ours, then maybe you should be. But most primary care doctors, urgent care centers, ENT practices, or audiology clinics can help you out. I'll catch you in the next video, hopefully with both of your ears wide open so you can hear my dad jokes with crystal clarity.